As KPLC celebrates 60 years, we're taking a look back at some of the biggest changes in medicine over the past 6 decades. From the development of minimally invasive surgeries to new imaging tools and medications, KPLC's Brittany Glazer reports on just a few of the heart and brain breakthroughs that have saved countless lives.
Evidence of brain surgery dates all the way back to the Stone Age, but what's really bizarre is that some of the tools used thousands of years ago didn't really change much until the past 60 years.
60 years ago, neurosurgery wasn't much different than in the Neolithic period. Back then, there was evidence of trephine of the skull, where people would drill holes in the skull to release evil spirits.
Christus St. Patrick Hospital neurosurgeon Eric Wolf says the dramatic changes in brain and spine surgery are due to modern-day breakthroughs like the operating microscope in the 1950s and 60s.
The surgeon and the assistant look through the eyepieces, and then we navigate the microscope around.
That provides clear, detailed images that had not been seen before. Better imaging and smaller tools have also paved the way for minimally invasive surgeries on the brain and spine.
Operations on your back, you'd have incisions this big or maybe even bigger. Nowadays, with minimally invasive surgery, we can make incisions that small.
That means less blood loss and post-op pain. Computer-assisted surgeries and imaging equipment like the O-arm represent what's happening now in neurosurgery. Now to the heart, where cardiologist Michael Turner says the risk of dying from a heart attack has decreased by 50% over the past 60 years, thanks to less smoking, more exercise, and the development of clot-busting drugs in the 80s.
At first, these were given intravenously that broke up the clot that had blocked an artery, causing a heart attack, and this resulted in less heart muscle damage, shorter times in the hospital, and more people surviving heart attacks.
The 80s also saw the development of balloons and stents to keep arteries open. The breakthrough in the 90s was the creation of the defibrillator.
We began to learn how to pick out those people who were at highest risk of dying suddenly from an arrhythmia and implant a device called a defibrillator early on so that it would be there to treat that person outside the hospital if a cardiac arrest occurred.
The most exciting development for Dr. Turner has been the cholesterol-lowering statin drug.
You could actually change the outcomes of people who are at high risk for heart disease by taking one little pill a day.
Dr. Turner and Dr. Wolf say the future of their fields will focus on genetics and targeted gene therapy. At your service with Healthcast, Brittany Glazer, KPLC 7 News.
Now, tomorrow night, Brittany will take a look at how chemotherapy and new cancer drugs have transformed cancer treatment. She'll also talk to a pediatrician about immunizations that have eradicated once common and deadly diseases. Well, KPLC